Okay. All right, start from the top. Welcome, everyone. It's great to have you with us tonight. Thank you for coming. So we're just going to give you a little bit of background about MAiD. Many people don't understand exactly what it is. It's an acronym. It stands for Medical Assistance in Dying. This term is only used in Canada. No other country has this term. It includes what's called euthanasia, which is a direct a needle that is given to inject a couple of medications, which basically end the life of a patient. It's a lethal injection. Assisted suicide is used more frequently in the United States. Assisted suicide is where you take medication on your own, which ends your life. A very, very small number of people in Canada are actually using assisted suicide. It's mainly lethal injection in Canada. The term MAiD was chosen because it's a little more palatable to the public. Medical assistance in dying doesn't sound as disturbing as euthanasia does. How did we get here? Well, in 2015, a Supreme Court of Canada decision struck down sections of the Criminal Code of Canada that had a prohibition against murder. And the sections that they struck down, the court basically said that in some circumstances. Now, the problem with that is that the first decision was made by one judge sitting alone in British Columbia. And that judge set the criteria for MAiD in Canada. Now, this is a problem from a legal perspective because in most countries, the people who set policies are the politicians. Why is that? Well, if the politicians set the policies, you all have direct access to your MP. But if a judge in BC sets the policy, you have no access other than to be part of that legal case if you're part of a group, and the cost of that is roughly $50,000 or $60,000. So what's happening in Canada is that we're allowing the judiciary to do the job of the politicians, okay? And so this became a problem in 2021 because when the first law was passed in 2016, it intended to restrict MAiD so that it was only for people whose death was reasonably foreseeable. That was the first legislation that came out in 2016. Yeah, it was in 20. Yeah. So the test was, is death reasonably foreseeable? So was at the time, what does reasonably knew? But the idea was you had to be dying or on your way to death to get euthanasia. This is what the average Canadian thinks the law still is. So many are in favor of it. But in 2021, the law changed. That section got struck down because of a judge, and because the judge went back to the criteria written by the first judge. When I saw the criteria written by the first judge, I have legal training. When I saw the criteria that was established by the first judge, I said, there's so many loopholes in that you could drive a Mack truck through it. And sure enough, when the law of Parliament got challenged, then the Prime Minister at the time decided that rather than challenge the decision, they would just change the law. So in 2021, the law was expanded so that people with disabilities and chronic conditions could get MAiD. In other words, you don't need to be dying to get MAiD. So this was a huge expansion. At the same time, they included mental health as well. So that means if someone's illness is a mental health related illness, that can qualify you for MAiD, even if you don't have any other health problems. Now that will come into effect in 2027. The law is currently on the books, and in 2 years, this law will take effect. And then MAiD will be open to people with mental health problems. As I mentioned before, this is an extremely problematic thing Well, for any of us who have people in our family who have mental health concerns, and there are many people who have mental health concerns, but it's also a problem for physicians because in Nova Scotia, they're required to advise patients when they might qualify. So if someone's having suicidal ideation, then there'll be an obligation to advise the patient that they qualify for MAiD. Yes. Why is this moving? I think the question is, why is this moving so quickly? Why is this expanding? Yeah, I think that there's a number of things going on. This is a question, a very good question. I always get this because the average person, when I explain this to them, they can't understand why this is moving so quickly, why there's so much public support. I think there's a number of factors at play all at the same time. I think that there are activists who really are out to normalize suicide. Dying with Dignity is the #1 advocacy group advocating for increased access to medical assistance in dying. But they have people on their board, I know from discussion, who are wanting just to have access to suicide with no limits. And I think it's got to do with a sense of personal autonomy. They feel that individuals in society have the right to get a doctor to end their lives. So there's that group of people. There's a group of people who think that it's the more humane thing to do rather than someone suffering, to kill them. And then I think we have to be honest and realize that with the current challenges to the healthcare system, some patients are seen as bed blockers. Yeah. So presently, since 2016, euthanasia and assisted suicide have accounted for on the slide it says 60,000 deaths. That's just up to December 2023. I would estimate that probably it's closer to 75,000 deaths, as we're killing about 12,000 people a year through MAiD. Yes.
Does the dementia in the elderly come under the umbrella of mental illness?
I'm going to be dealing with this very shortly, but you talked about dementia in the elderly. There's a push. Part of the problem is, well, it's not a problem, it's a safeguard. In order to get MAiD in Canada, you have to be competent. So there's a push now for what are called advanced directives. So if someone has an illness that might affect their competency, let's say they're diagnosed with dementia, and the doctor says, yes, at a future time, you could have dementia and you might lose competency. So if advanced directives gets passed, then, and it currently is the law in Quebec, the government of Quebec in October just declared that in Quebec it would be legal, even though it goes against the criminal code. And the federal government, instead of challenging what they were doing, now is surveying the rest of Canada to see how others feel about it. So we could very well have, under the new government, we could very well have advanced directives legalized. Now this would mean that at a certain point in someone's illness, they would write a document that would say, this is when I want to be killed. Now, what's wrong with that? Well, there's a couple things wrong with that. One is, nobody knows how they're going to feel when they're incompetent. We have a geriatric psychiatrist who is a member of our association who said she's never had one demented patient ever asked to die. Because actually, patients with dementia or Alzheimer's can be quite happy. The other problem is that the competent patient can ask to die at such and such a point, But when you go to kill the patient is begging to live. What do you do in that case? Well, it happened in the Netherlands, and they held the patient down and euthanized them despite them asking to live. Because in the Netherlands, they said, you asked to die when you were competent. Now that you're incompetent, you don't have any capacity to tell us that you don't want to die. Yeah. Yeah. Now, so what 60,000 deaths look like? Well, it's roughly the population of Fredericton, New Brunswick, or the number of people who were at the Taylor Swift concert in BC, just to give us an idea. So where are we going? What are called mature minors, or people under the age of 18. There's a recommendation in to government now from a joint parliamentary committee that MAiD be allowed to be given to children. There is no minimum age, and it's important for you to realize that once a child is called a mature minor, then they can get MAiD without necessarily having the parents' consent. Advanced directives I've already explained, right? And I have to tell you that I completed the form developed by the federal government, and it was extremely biased in favor of advanced directives. So I would venture to say that Health Canada is in favor of advanced directives, and it's something you could be seeing in the next couple of years. And so where are we going? I think we are headed to death on demand. I would never have ever guessed that we'd move as far as we moved in the last 9 years. It seems as though the courts are driving this, and the politicians have no political will to put on the brakes. The Conservatives, Pierre Poilievre, during the election campaign, said there would be no further expansion of MAiD. Unfortunately, the Conservatives didn't get elected. So I have no indication that there's anything to stop the courts from their advance in this area. Yeah. And I found politicians federally and provincially terrified to touch the issue. Their perception is it's very popular. They don't want to be perceived in the news of being against it. So let's just compare Canada to other jurisdictions. That's a little faint. I hope you can see it. The orange line started in 2002, and they're now up to about 5%. On the axis on the bottom is years, starting in 2002 and going up to 2023. And the axis on the top is percentage of total deaths due to euthanasia. So 5% is at the top. So the orange line is the Netherlands. You can see they started in 2002, and they're up to about 5% by 2023. Belgium is the yellow line, and you can see that they started in 2002, and they're up to about 3%. Switzerland is there. And the little green line at the bottom is California. Now, the reason they're so low is that they use assisted suicide, not euthanasia. They force the patient to actually take the medication that's going to end their lives. And it turns out that patients are reluctant to take their own lives. They don't like assisted suicide because they don't want to take the responsibility for killing themselves. They would prefer to have a doctor do it. That's why their numbers are so low. Canada could have taken that direction. Canada could have gone the way of the United States, which is all assisted suicide, but instead decided to go the way of Europe, and now this is what we have in our hands. If you look at the red line, starting in 2016, you'll notice that we're almost caught up with the Netherlands in those 9 years. Well, actually, it's only 7, 8 years. You see, we've almost caught up there in terms of percentage. But because our population is higher, we've killed more people in Canada. We're killing more people in Canada per country in the world. And Brad did this before they all started the same line. And you can see that this shows really clearly how Canada has increased rapidly compared to the countries. So tonight's presentation is what's wrong with MAiD. And we spent a long time with staff trying to boil with 3 things. The first thing is that it endangers people experiencing vulnerability. It endangers vulnerable people. The second one is if death is a therapeutic treatment, what is the incentive to do anything else? So if death is a therapeutic treatment, what is the incentive to do anything else? Yep. And I think I mentioned to you earlier that the Nova Scotia College asks doctors to advise patients when they might qualify. It also requires doctors to make referrals. In other words, what the Nova Scotia College is doing, it's treating MAiD like any other medical procedure. So like getting your knee replaced or your appendix out, MAiD is treated like any other medical procedure. The fact that it means that you're going to kill a patient and that decision is final doesn't register with the college. They see it as being no different than any other treatment. Well, the mention was about the Hippocratic Oath. When my son graduated, they changed the Hippocratic Oath at Dalhousie University. It was very disturbing to him and his Christian colleagues. They couldn't actually do the oath because the oath they've chosen at Dalhousie doctors to end the lives of patients. Yeah, this is all happening very rapidly. And ironically, Halifax is has many of the leading advocates for MAiD in Canada. Four of the main leaders in MAiD in Canada are all in Halifax. But the final thing that's important for us as Christians is we are not the authors of our lives. Our lives come from God. God decided when we were going to be born, and God should decide when we leave. We're going to talk some more about that. So it endangers people who are experiencing vulnerability. What do we mean by this? Well, a few months ago, Brad and I got a call from in Nova Scotia. I won't say which community she's in because she's concerned about privacy. This lady has, at least since she was in her teenage years, multiple disabilities. She's 51 now. A couple of years ago, she found a breast lump and had to have a radical mastectomy. And then a few months later, she decided she would have a mastectomy for the second breast as a preventative thing. During those interactions with the medical community for the two mastectomies, she was offered MAiD 3 times. And she is certain that they did that because of her disabilities. One of the times the anesthesiologist, before they wheeled her into the OR, so she's sitting out in the hallway with a Johnny shirt on. Any of you have ever had a procedure know how that feels. She's there without her husband. She's going to get her breast taken off, and the anesthesiologist is talking with her about MAiD. But the thing is, if MAiD is just another medical treatment, then the doctor would see nothing wrong with that. Right. Yeah. What would you say if you had a friend who was experiencing isolation and loneliness, inadequate pain control, they felt like they were a burden on their family, they felt like they had a loss of dignity or a loss of ability to engage in meaningful activities? If you had a friend who was maybe disabled and you were having coffee with them and they were talking about how they felt, what would you say to them? Yeah. Yeah. So you would acknowledge their feelings. You would encourage them, support them. Yeah, in dealing with this. Would you suggest they die? No. So why do people choose MAiD? I'm going to just walk over close to the chart so I can see it a little better. The first, I shouldn't say the first reason, but the federal government has a survey that they do for everyone who chooses MAiD in Canada, and they record the survey results. And they provide the statistics once a year in a report. In 2023, they indicated that 21% of patients who chose MAiD did it because they were suffering from isolation or loneliness. And when you're looking at people with disabilities, that number shoots up to 47%. So the people with disabilities that are dying by MAiD, 47% of them are suffering from isolation and loneliness. 45% felt that they were a burden on family, friends, and caregivers. This was causing them suffering, and that's why they wanted to die. 54% said they were either afraid of inadequate pain control or didn't have adequate pain control. Yesterday, we had a presentation from a palliative care nurse who said that with proper palliative care, no one needs to feel any pain at end of life. In the very small number of cases where they can't control the pain, there's something called palliative sedation. When someone's actively dying, the doctors can give them palliative sedation, and so they just don't experience any pain as they're dying. 65% said they experienced a loss of dignity. That was their. The problem with the term dying with dignity is that it assumes that at a certain point a person can lose their dignity. So the idea is we'll kill them now before they lose their dignity. But if we're Christians, where does their dignity come from? It comes from God. And is my dignity any less if I'm not good looking or smart or healthy or able-bodied? Does God think I have more dignity because of those things? No. Pope Francis had dignity right up until. So there's a problem. Loss of ability to engage in meaningful activities, 95%. So what is the common denominator with all those reasons that people are giving that they want to die? The common denominator is that with proper counseling, care, and support, they might not have needed to die. Yeah, and there are doctors who've described ways called dignity therapy to help patients have a greater sense of their dignity and to understand that. This is a sobering quote. This was from an article in Maclean's magazine 2 years ago. Dr. Madeline Lee provides MAiD at the University Health Network in Toronto. It's a large health network of all the teaching hospitals in downtown Toronto. Dr. Lee provides MAiD. This is what she said. Canada's MAiD laws are missing fundamental safeguards for vulnerable people. Canada's MAiD laws are missing fundamental safeguards for vulnerable people. Yeah, that's right. And Dr. Lee is a MAiD provider who has said that. What's her concern? Her concern is that it's a checklist. I don't know what it is in Nova Scotia, but I know in New Brunswick, if you go online, they actually have a checklist. And anyone who can check all the boxes gets MAiD. Are you 18 or above? Do you have a grievous and irremediable health condition? Are you competent? Those sorts of questions. Dr. Lee says that doctors are just going through the checklist, and if someone checks all the boxes, then they assess them and they give them permission. It's common that people do not get the counseling that they need. if you deal with a properly trained palliative care person, they will listen to you until they understand the source of your suffering, and they will help you look at various ways that suffering can be dealt with rather than ending your life. But Dr. Lee is saying that doesn't happen in every case. As a matter of fact, she feels it doesn't happen in many cases because the law doesn't require it. So she feels that vulnerable people are slipping through the cracks. Most Canadians, when they think about MAiD, if they're in favor of it, they think, well, if I was ever in a situation where I'm suffering uncontrollably from pain and I was just about to die, I would want them to put me out of my misery. That's what they think about. That's their mind frame. They don't think about someone who's not immediately dying, someone for whom there are treatments, and someone for whom there's not enough time for the doctor, a good qualified doctor, to sit with them and go through all the options. The second thing is that if death is a therapeutic solution, what's the incentive to do anything else? Right now, there's problems with access to care. You know that in Nova Scotia, I don't know what it is, I think it's 100,000 people don't have doctors. Only 30 to 50% of Canadians have access to quality palliative care. Now, Nova Scotia has a good palliative program. I haven't heard a lot of criticisms of it. But right now in Nova Scotia, every hospice must provide MAiD on the premises. You probably have heard of St. Martha's Hospital in Antigonish, the Catholic hospital. They were required to provide MAiD on the premises. They couldn't do it and still be a Catholic hospital. So the province took over one of their buildings where they provide MAiD. This will give you an idea how militant, and I said militant, the pro-MAiD activists are in Nova Scotia. Disability, many disabled people struggle to access healthcare services and felt that they were invisible. As a result, individuals' mental health was negatively affected. This is from a study on disabled people accessing care. In 2021, when this passed, the government, when they opened MAiD to disabled people, the government promised they would look at the disability benefit and increase it so that it couldn't be said that any disabled person was choosing death because they couldn't afford to live. Well, the government didn't do anything about that until January or February of this year when they announced it was going up $200 a month. $200 a month with the inflation we've just been through is very little. Many in the disability community are dying, and many are bitter because they feel as though the government, rather than giving them the proper amount that they need to live, the government has just opened the door to MAiD. Mental health. Well, in 2027, when mental health is legal and you'll be able to die just because you have a mental health condition, you'll have a 3-month waiting period to get access to MAiD. Currently across Canada, the average waiting time to see a psychiatrist is 6 months. And in Nova Scotia, it's more like a year. So we're going to be able to kill you for your mental illness in 3 months, but it's going to take a year to get proper care. The most challenging case that I've ever heard about this is a quadriplegic gentleman by the name of Normand Meunier from Montreal. His wife, he was a quadriplegic. His lifelong partner and advocate for him had a respiratory infection for which they went to the emergency room. There wasn't a room to admit him, so he had to stay in emergency. But in emergency, they didn't have full-size beds. They just had those cots that you often see in an emergency room. His wife warned the doctors that if Normand didn't have a proper mattress, she was ignored. They said, we can't bring a normal mattress into the ER. This went on for 5 days. Normand developed extreme bed sores, and they became so serious that he asked to have MAiD. So he said he didn't want to be a burden. So this is a situation where the system itself failed Normand, and Normand became a statistic. Normand died because of the failure of the system. And this is happening perhaps in not as dramatic way all over Canada. There's two documented cases of health authorities in Ontario where the health authority was told that they had to develop a MAiD program within their palliative care budget. So they actually took money out of palliative care to provide the MAiD program. What this means is that people would be more likely in those health units to choose MAiD because there's less palliative care available. Fred Sandusky, now to the other end of the country in Saskatchewan, Fred was needing additional care. He and his wife were not well off. In order to get the proper respite care for his wife, it was going to cost him $1,380 a month extra. Fred didn't. He asked the Ministry of Health for help. They refused to give it. He could access MAiD. Fred and his wife found out that if they were not married, they would get more money from the government, so they divorced to help get more money. And the latest thing is that Fred still doesn't have the money to do this, and so his options are to choose MAiD or go home without the proper care for his disabilities. There are many, many stories like that. Brad and I just came from Miramichi, and we spent a couple of hours this afternoon talking to an 86-year-old priest. He was up on his roof, and he was embarrassed that he fell off his roof. And he was rushed to the emergency room where he was treated. When he came to, there was someone from the hospital was there with forms. They said, we need you to sign these forms. So he looked at the forms and he saw the word MAiD, and he said, I can't go along with this. You know, I'm a Catholic priest. And the guy said, well, you know, I'm required to show these to you from above. And the priest said, well, I don't think God asked you to show me those forms. But what we've discovered is that everyone who comes in gets asked about MAiD. And he said his hand there was a laceration in his hand so bad he could see the bone. They didn't even treat the hand. Their first concern was to talk to him about MAiD.
Is that for do not resuscitate?
No, this isn't DNRs. This isn't DNRs. DNRs are standard. Now they're also including MAiD.
So MAiD will become standard.
Yeah. 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 We even heard of one case in Halifax where a person, one of our parishioners, had a weak spell at home. They called the ambulance. The ambulance attendant came in and asked her about MAiD. Yeah. Now, at the same time, in Ontario, there's a recent coroner's report that is showing that there are real irregularities in the way MAiD is being administered in Ontario. 420 cases of possible criminal violation in Ontario alone. 428 cases in 1 year of criminal violations. In 2023, the Ontario Coroner's Office raised concerns for a quarter of all euthanasia providers in Ontario. And 29% of reported Track 2 cases involve patients living in poverty. These are for people with disabilities. There's the people who are dying, there's a higher incidence of poverty amongst these folks than there is in the general population. Now, finally, we're not authors of our own lives. God said to Moses on the 10 Commandments, you shall not kill. This is not something that the bishop thought up or your pastor or even the Pope. This comes from the big guy. You shall not kill. You shall not murder. The Catechism of the Catholic Church says that euthanasia is murder. You shall not murder. Incorporates that in Matthew 19:18. The rich young man comes to him and says, "What must I do to have eternal life?" Jesus tells him, "Keep the commandments. You shall not kill." And Jesus says, whatever you do for the least of these, my brothers and sisters, you've done it to me. What was the impetus for the development of hospitals in the Christian faith? What motivated us, Christians, to go out and develop hospitals like St. Martha's in the first place? What motivated us was a sense that in that vulnerable patient is the person of Christ. My own father died of squamous cell cancer on the side of his head. It eventually eroded his skull. And I used to tend the wounds in the hospital because I felt like the nurses weren't doing it right. And I would tend the wounds on my own father's head. I felt as though I was tending the wounds of Christ. And so that's the motivation for Christians in healthcare. But Christians no longer are running healthcare in Nova Scotia. And so it's being replaced with not we're serving Christ, we're serving a person, a number. And if that person decides that they want to die, then we give them the support. We support them, we facilitate it. This is what Jesus says, "If you love me, keep my commandments." Now, I'm a lawyer, I can't find a loophole in this. I've met so many, I met many Christians who say, "What's wrong with MAiD? I can't understand it." Well, you just have to go here. This is what Jesus said. "If you love me, keep my commandments." Don't kill people. Don't support the killing of people. Don't vote for people who are supporting the killing of people. Stand up and say something. I had these two wonderful Christian sisters. There were two Catholic sisters in Sydney I met. One of them had been through our program. They were at a talk. They were either very devout or suckers for punishment. But they said to me, "Oh, Deacon Larry, it was so upsetting. Our brother wants MAiD." And the brother called his sister and said, "This is what I've decided to do." And she said, "I just said to him, it's your decision." And then she goes, "I guess I didn't say the right thing." I said, "You got that right." If someone says to you, "I'm thinking about killing myself," let's say you're walking by a bridge one night and there's someone there and they're looking pretty sad and they're just about to jump in. I think, "How are you doing tonight?" "Oh, I'm pretty depressed. I think I'm going to jump in and kill myself." You say, "Well, it's your choice." How many would say that? Huh? Why do you say something different when your brother says he wants to get MAiD? Hello? Why do you say something different? There's a problem. There's the sweet, holy lady said, "If I had a chance, I wouldn't say that again." Because if someone says, "I want to kill myself," maybe they're waiting to hear from their sister, "Please don't do it. You mean so much to me. We want you to be around. We want to celebrate all the time we can have with you. And if you're worried about pooping your pants, I'll be there to change you." Which is the Christian response? The latter. Thank you. So what's wrong with MAiD? It endangers people who are experiencing vulnerability. If death is a therapeutic solution, what's the incentive to do anything else? And we are not the authors of our lives. So, freedom of conscience. We're living in a province that does not have freedom of conscience for healthcare professionals. As I already said before, there's a policy that's been in place for 1 year here in Nova Scotia, College of Physicians and Surgeons of Nova Scotia. And there's a policy that says that doctors must make effective referrals for patients to someone who'll do an assessment for MAiD. Now, it's the most strict and rigid policy in the country, and Catholic physicians may not make a referral for MAiD because it is formal cooperation with evil. Morally speaking, it's morally the same as actually killing the patient yourself. It's not just Catholics, but evangelicals, Orthodox Jews, and Muslims really don't want to get involved in it either. In addition to that, you are required to advise the patient when they might qualify, even if the patient doesn't ask. So if your patient is an 86-year-old priest who's just fallen off a roof, you're obligated to tell him, Father, you don't need to be fixed up. You would qualify for MAiD. You're pretty banged up. You sure you don't want to die? Yeah. Yeah. So if you've got any free prayer time, please pray for the College of Physicians. Please pray for our politicians that they get a backbone and actually do what's right, as opposed to what's going to get them votes. Brad can take your information tonight if you'd like to get on our database. We do frequent letter writing campaigns. We have a nice software program. It takes about 2.5 minutes. You just go on there and you can send a pre-written email to your MLA to encourage them to get involved in this discussion. Okay? Yes?
Is there a policy in place at the hospitals if there's a nurse or a doctor who does not want to be part of it and step up and then are they obligated to go? The policies are in effect everywhere, even at St. Martha's. So there's an obligation to make a referral to another physician. So if you're seeing a patient in the hospital and the patient says, I want MAiD, under the policy, you're obligated to advise to connect that patient with someone who can do the assessment. Or the procedure?
Yeah, you will lose your job if you don't do a referral. No, the referral. No, you don't have to do. You actually don't have to do the procedure. You don't have to do the procedure. You don't have to kill anyone. Yeah. A doctor or a nurse. No. The way it would work with, let's say somebody wants, let's say a patient is in hospital and the patient says, I want MAiD. So the correct way to do it is you would dialogue with the patient, try to determine what their needs are, why they want this. If the patient still insists on it, then your obligation is to call the MAiD team and have them come down and see the patient. The MAiD team comes down to see the patient. That doctor can do the assessment, and the MAiD team would actually do the MAiD. What our doctors object to is the fact that they is participating in the practice. And I don't know if you realize this or not, but the provincial government provides access to MAiD with a 1-800 number that's available on the website for Nova Scotia Health. So anyone can phone at any time. And what we feel is that given that there's such good access, or the other thing is if you're in hospital, you might be able to talk to this doctor, but you can talk to a nurse, you can talk to the person who's cleaning your room, or the orderly who's pushing you. Anybody can contact the MAiD team. You can phone the MAiD team yourself if you have a telephone. So the thing is, our thing is, why are you forcing our doctors to have to be involved in this at all? And I think the answer for that is that they want to force us out of medicine because they think that anybody who refuses to embrace medical assistance in dying is a callous, hard-hearted person
who cares more about their own faith than they do about the welfare of patients. So we heard through the grapevine that officials at the college referred to our 42 doctors as irrelevants. In other words, these are people we do not want practicing medicine in Nova Scotia because they have deviant, non-medical opinions. Their opinions are not science-based. They're based on religion, which is not real. And we really don't want them practicing here in Nova Scotia unless they can control themselves and get with the program. That says, I don't think I'm being overly, overstating it. I think that's exactly where we're at. And it's very hard for the average Christian in Nova Scotia to understand that this is going on because it seems to be so outside of anything that we've ever considered. We perceive ourselves to be living in a country that accepts minority views, that is a pluralistic country. But what's happening is that as these things get pushed and they get more and more life, then we begin to see that there is a very strong secularist push to control healthcare. And you're all being swept up in it, whether you know it or not. I have a grandson, for instance, who's on the autism spectrum. He's verbal, he's very smart, he's a sweetie. But at a certain point, when he becomes an adolescent, he's going to realize he's not like other boys. That normally results in some level of depression. And the incidence of suicide amongst people on the autism spectrum is quite high. And once he's 18, he's going to be eligible. I've had pro-MAiD people say to me, "What right do you have to limit my right? It's my own body. What right do you have to limit my right to die?" I go, "What right do you have to take away my grandson? What right do you have to create a healthcare system where I have to worry about him being killed?" That's right. They don't relate to how their desire is affecting the system. I went to a public session one night in Barrie, Ontario, and the government of Ontario was doing a fact-finding mission, and I intentionally sat with a bunch of people from Dying with Dignity because I wanted to get a sense of where they were coming from. And they were all, "Well, it's my life, it's my body, it's my right. Why shouldn't I be able to die if I want to die?" So I listened and I said, "Well, that's all well and good, but," I said, "what would you do if one night your son drank a little bit too much, say he was a teenager, and he jumped in the wrong end of a pool and he woke up the next morning as a quadriplegic?" And the first thing he says when you visit him is, "Mom, I want to die." How would you feel then? And their response was, "Oh, there's social workers to deal with that." They have no idea. The proponents of MAiD they're only thinking about themselves at the end of their own life. They're not thinking that there is no way for the law to say this person can get it and this person can't get it. Once you open the door to it, and with the courts going the way they are, they just expand and expand and expand and expand till everybody can get it. And then nobody's safe. That's the problem. Yeah.
What's the difference in asking that life-giving medications being withheld from in the hospital and sick, for example, somebody is diabetic, and they say, "Okay, I don't want insulin." Usually they refuse to have regular medications.
Generally speaking, when someone's actively dying, there's no obligation to take treatment or to take what are called heroic measures. So, for instance, you might opt not to do chemo if it's not going to dramatically increase your chances of survival. That'd be an example. Yeah, that goes back to a DNR. So there's no, yeah, that's right. So for a Catholic and for most Christians, the withdrawal of treatment is not necessarily a bad thing if someone's actively dying. Okay. Now, the withdrawal of treatment for a 24-year-old who's perfectly healthy otherwise, that's a different story. But we're not obligated to do every treatment in the book if we're dying. At a certain point, you understand this is the will of God. I'm dying. There's nothing else that can be done. And if I take chemo, I'm going to be uncomfortable for the next 3 months. If I don't take chemo, maybe I'll die in 2 months, but at least I'll have 2 months of comfort, right? You're just basically letting the disease take its course. Similarly, if someone's in a lot of pain, then you're allowed to treat the pain with pain relievers, even to the point where the pain relievers might actually make you die faster. It's all in the intention. If your intention is just to relieve the pain, then that's perfectly acceptable. But you can't have the intention of actually killing the patient with morphine. Yeah. Does that help? Yeah, it's a little, but the thing about MAiD that's totally different is you're giving someone a lethal injection. You're actually intending to kill them and you're killing them. Yeah. You know, it's very serious from a moral perspective, especially for Catholics, because the Catholic Church, and these are documents published in the last year, signed by Pope Francis. The Catholic Church says that euthanasia is intrinsically evil. That's a category of activity like abortion. It means that it doesn't matter what the circumstances are or what the intentions are. If you participate in it or you ask for it, it's wrong. And not only that, if you are competent and you intend to do it, it could be a mortal sin. You are at risk of committing a mortal sin. And as we all know, a mortal sin means that you are separated from Christ for all eternity. Now, we can't judge. If you see someone go through this process, you can't judge them. But all I'm saying is that the risk of a mortal sin is much higher with MAiD than it is with what you might call a normal suicide. The normal type of suicide, people make that decision under the influence of the mental illness. But with MAiD, you're making that decision and the state is ensuring that you are competent and you know what you're doing. I said to somebody, it's like a mortal sin machine because, and many Catholics don't even know, I mean, maybe they're willfully blind, but they don't even know there's anything wrong with this. But the problem is that you're going through this process where you are basically saying to God, God, you gave me this wonderful life. I took all the good things, but I've not taken these rough things. So take it back. I don't want my life anymore. And so you're choosing something that's intrinsically evil. You intend to do it and you're competent. None of us can say where that person is in the terms of their destiny, but as a deacon and you know, as someone who cares about you, I have to warn you, this is very, very serious and you could lose your salvation over it. So, the bishop, we've just finished a pamphlet that the bishop's going to offer to all the pastors. And it explains it right on there, and I hope all the parishioners get it, and I hope they all read it because the warning is right there, you know. So it's very serious. Okay.
They want them to die because they can't stand watching the process of them dying. Do they have any rights?
The question is, do family members have any rights in this process? The sad reality is that legally, no. So there was a situation of a lady down the South Shore, I think it was Bridgewater, might have been Liverpool. Her husband was wanted to die by MAiD. She felt, first of all, she didn't want him to die. She was Christian, he wasn't. But she felt, and she had doctors, friends of the family, who said that he was not competent. There was a disagreement about whether or not he was competent. And she went to court to try to get the MAiD stopped. She was unsuccessful. Most of them have been. The best chance you get is just in terms of being there for the person. So with my own dad, for instance, he got sick in 2009 before MAiD, but he wanted to die because of this cancer on the side of his head. And I prayed and I met with him and I said, Dad, why is it you want to die? He said to me, he says, I no longer have anything more to give. He was a man who was a giver. He had given to my mother. He had given to the kids. He had given to his family, to his church, to his community. Now he felt he had no longer anything to give. And so we talked about it, and I tried to help him understand that by letting me give to him, he was giving to me. I also tried to help him understand that he was still giving to people, even though he was very, very weak and vulnerable. And I can't, I don't want to go into detail here, but the amount of miracles that happened, the amount of things that he was able to do, how God showed him he still had the capacity to give to others, was amazing between the time he made that decision and the time he died. So I think more than anything else, people who are making these decisions need us to listen to them, and we can find ways to support them.
Has there been any cases where the parents that have applied for MAiD of a minor?
Currently in Canada, it's illegal to kill anyone under the age of 18. Yeah, but the College of Physicians and Surgeons of Quebec has recommended to the federal government that MAiD be allowed for children under the age of 1 who are disabled. This might be a direction that we go in the future. And that's a concern. Yeah, the most challenging, I've heard some just incredibly sad cases. There was a dentist who phoned me a couple of weeks ago, and it was very, very disturbing. Her case, she had a sister who had manic depression. And this 2 years previous, the sister had applied for MAiD and was approved for it, but changed her mind and wanted to live. And what happened was that incidentally, the doctor who killed this patient has killed over 400 patients. She contacted the sister. She asked her if she was still interested. The sister said she was interested in MAiD. The doctor drove to the sister's house, got her in the car, took her back to her office, killed her, and then used the sister's phone to phone the dentist to say, your sister has died by MAiD. Could you please come and do something about the remains? So in this case, her parents were elderly. The sister contacted me and said, what can I do? Well, the challenge here is that it's illegal in Canada to kill anyone just because of a mental illness. So this might be a case of murder. So the sister could go to the police and say, this is murder, please investigate. She could go to the regulatory body, the college, and ask to have it investigated by them. But my advice to her was, both of those groups will try to avoid getting involved in this. So I advised her to get a lawyer and to have the lawyer type up the complaint so that it was presented to both groups in an official fashion so they couldn't ignore it. But that would cost her about $20,000. She said to me, why can't I sue her? And I said, well, you could, but your sister's life is worth about $20,000. And the cost of going to court is about $200,000. So I was really, and as Brad has said in other presentations, I think I was depressed for 48 hours after that, just because you just think, what has this country become? We believe in our country. We thought we were compassionate. This is a situation where this is just totally out of control. What we think happened was that this doctor was so intent on ending this patient's life that he diagnosed another illness and used that to justify killing her. But when the sister looked through the notes, the medical notes she has from the sister's GP, there's no note of any diagnosis of that kind. So I think that people like this doctor, and that's 400. We know of a doctor who's done 571. I think that the people who are doing this believe that they're doing God's work. They believe this is a noble thing, that if someone wants to die, they should be able to die. But the problem is that they know the system, they know the procedure, they know the loopholes. Canada has one of the most lax laws in the world. It uses terms like grievous and irremediable illness. Well, it's not a legal term or a medical term. No one knows what a grievous illness is. They can do doctor shopping. So in Newfoundland and Labrador, no doctor there would give a particular patient MAiD. So the patient contacted Dying with Dignity. They flew a doctor from Toronto to St. John's, killed the patient. So the doctors get demoralized after a while, realizing that if they don't kill the patient, someone else is going to. So the whole problem here is that we're so arrogant that we think we can break the laws of God and everything will be fine. And we have this idea in our head that, oh yes, we're very technological people. We can put a man on the moon. We can do all these things. We can solve all these problems. We can decide who should die and who should not. But we can't, because we're not God. No, we're not humble at all. The wheels have gone off the cart and we can't even see it. Other questions? I just want to talk to you about a program that we have. So what can we do? Well, we can pray. You can share information on this. I hope you'll leave your email with us when you leave today. We can send you more information on what we offer, what we can do. And we hope that you'll be involved in letter writing campaigns. We need to write the Premier and tell them to take a testosterone shot and get active and do something to solve this problem. This is an excellent program. I just want to encourage you to take. I'd love to, has it been delivered here in Amherst? No. Yeah, it's called Dying with Christ, Living with Hope. It's a 3-video series. It's designed to be over 3 evenings, 25-minute videos. And basically it's a program about what it means to have a Christian death. Do you know in 2014, Angus Reid did a survey of Catholics and evangelicals in Canada. And these were people who had attended church at least once in the previous month. The percentage of people who were in favor of legalizing assisted suicide was 40% for the evangelicals. In other words, 40% of evangelicals who had been to church at least once in the previous month were in favor of legalizing assisted suicide. What do you think the number was for Catholics? 70%. Yeah. So we're in, yeah. So we need to desperately train our people so that they understand what a Christian death is all about. Because, Brad, do you want to come up and just talk about the program?
I won't say very much because Deacon Larry.
What's that? I know.
I do want to talk, but not as much as Deacon Larry. Yes, for the more people on live stream. Thank you, by the way, for watching us on live stream. Look, we can just stand close to each other. I don't smell that bad. So Dying with Christ, Living with Hope is designed to be done over 3 evenings, as Deacon Larry said, and it can be done. It can be done in groups of 2 or 3 or a half a dozen. I've seen it done in groups as many as 100. It can be done in person or online, and we do a train the trainer. And the next one actually starts Thursday night, 8 p.m. local time. We're a national organization, so sometimes I'm in my jams, at least from here down, doing the program. And what we do is we have these great opportunities to talk about what does it mean to die well, and to be able to equip us to have these conversations with our loved ones. As I shared with some of the ladies beforehand, my mom and dad and I have had these conversations, and it's tough because my brother doesn't practice. So how to have these conversations? Can you imagine being in a family? I have two sisters that did a course with me, or one sister did a course with me. Her other sister doesn't talk to her. Because when dad was dying, he wanted a Christian death, but he didn't tell anybody. So they fought over how dad should die, even though one sister knew what he wanted and the other one didn't. And both of them thought they were right. And she says, we definitely said things we shouldn't have said, but now they're fighting and now they're broken. All because somebody didn't say, hey, listen, this is how I don't believe in MAiD. I just want to go this way. And it gives us an opportunity to be able to talk to our loved ones about what we believe and what we think is right. And so no matter how, and I know some of you are probably going, well, no, I could never get up like Deacon Larry and do a presentation like this and help facilitate this. It is, we literally have it all scripted out. And maybe you're not going to present it at the church hall. Maybe you're going to sit down and have a cup of coffee with somebody you love who you're worried might make this choice down the line. And you can show them some videos and you just have a little chit. We have workbooks. The only cost of the program is a suggested donation of $10. And the reason I say that is because the board of directors for CMDA has said very specifically that if anyone in Canada wants to take this program, do not let money be a reason not to let them there. So sometimes I just every time I just send some books up to some place and I pray to goodness that money comes back because I like to eat, and look at me, I really like to eat and I'd like to feed my children. And it does, and it's worked everywhere. And the best part is that we're having these great conversations where we get to hear about each other and we get to love each other. And we get to take care of the vulnerable people that sit in these pews some Sundays and love them. And I'm sure some people, myself included, sometimes wonder, does anybody love me? Well, God does. But if you don't know that, it can be very challenging in this world. So, sometimes people are like, how do I have these conversations? Well, that's part of the beautiful program. So this program was designed by CMDA. The money literally came from a donor who saw what was going on in Canada and wanted to make a difference. Here's the beautiful part. There are four Christian doctors, am I right? Three doctors and one palliative nurse, all Christians, all palliative care specialists who talk about it. There's two wonderful men named David who appear in the video. They're both theologians. One's Catholic, one's evangelical. You can't tell the difference until you see the name tag because they're singing from the same hymnal. That we all believe that we are not our own and that a life than this. And that if we live a great life, we go be with Jesus someday. And we want to get it. I don't know about the rest of you, but I'll speak for myself here. I want to bring as many people as possible with me. And this is an easy way to do this. And when you get down to the nitty gritty and say 6 months from now, you're going to run the program and you're like, I don't know how to do this. Well, fortunately, CMDA has an employee. I used to run programs in Catholic churches for 20 years. And I would be happy. I've had phone calls as simple as, how do I make my poster to please send me 25 more books because I put one lady, God bless her, I'm going to finish Larry, I promise. This one lady said, oh, nobody will come. So she bought 20 books. Then she had to buy 15 more. Then she had to buy 15 more. After the program had started, she's one of our members, and she's like, I didn't think anybody would come and talk about this. There was a parish in the city. They've done it 2 years in a row. The first time they had 100 people. The second time they had 65 people, and they had half of a nearby church come in because they want to run at their church. If somebody like me who just gets up here and rambles can run this, I'm sure all of you wonderful people can as well. Yeah, so you come online on Zoom for about an hour and a half, hour 45. And the first 15 minutes, I'm going to walk through like how to promote it, how do you invite people, how do you make a team, all of those simple things. Well, I say simple, some of you might be going, you're crazy, that's going to be hard. And then we go through the course, kind of like if you've done an alpha program. So you're going to experience it. You're going to get to learn that. The thing that I learned very quickly was that these are the most, I did small groups for 20 years. These are the most intense small groups I've ever done. Because all of a sudden you start talking about some of the most important moments of your life when you lost, my grandmother died 20 years ago. And if I talk any more about her than say her name, I'm going to well up, because she was one of the most important women in my life, because she lived with me from the moment I was born and was there and walked me to the end of when I got married. She made it to my wedding by about 6 weeks. Doesn't like my wife very much, but nobody was good enough for Nanny's little boy. So you had these conversations, and normally I would have a box of Kleenex because people like me exist, and you put the box in the center of the table, and I walk through, how do you do this and have these important conversations? Because we need to have them now, so that we're not sitting in front of somebody's bedside having arguments as families over how somebody should end their life. So 3 weeks, we do it over 3 weeks, just like you would if you were running the course in your church. And at the end of each night, I stay online until either I fall asleep or people stop asking me questions. And I try and make sure that we can answer any questions that you have to make sure that you're successful. But the fun part is that, like, we have people from all across Canada. The course, I called it the coastal course, because we had half the course was from here, the other half was from British Columbia. And we have people that come, they're of all Christian backgrounds. We get to learn and dialogue. And the beautiful thing is, if you run it in a small town like this, where there's a couple of other churches, it's the kind of thing that you could work together on. And in fact, those small groups are some of my favorite things we get to do, because you learn from all the different traditions. And when the church works as one body, we can do a whole lot of good in the world. And the other fun thing is, you often end up with a couple of doctors on the call. So, we teach you little things like, for example, you don't have to answer any of the medical questions. You can find doctors that will do that. And if you can't find a doctor, I have members that will act as a pen pal and answer questions for you. Who, by the way, if you invited them to come, would be thrilled. So after night 2, we usually have a doctor, because we talk a lot about the medical things. And after night 3, you have one of your wonderful priests that I've met. They can come in and answer some of those, like, theological questions. And if you're from a different tradition, we invite you to bring your pastor in to talk. And then you can identify some of the issues. We did this at a Pentecostal church in Halifax, and the pastor, and we had a wonderful conversation. At the end, he said, "Can you come to the last night and just take some pictures and whatnot?" We were chatting. It went on for almost 3 hours. It's supposed to be 90 minutes. But they realized that the pastor and this one family doc who was retired were the only people visiting people in that church when they got sick. And so they had a serious conversation. And by the end of it, they had 4 people that were going to help with the funeral ministry, and they had 0. And they now have 6 people going to visit sick people, because that's what Christians do. I think they thought somebody was doing it, and nobody was. Is there anything else, Deacon Larry? Do you guys have any questions? If you just want to take a minute before you leave, I'll be out there. I have, no offense to anybody, but if you have handwriting like mine, I won't be able to read it tomorrow. So I just take a few minutes and have you fill out a quick digital form. And if you can't do that, I'll stand next to you and help you with it with the computer, I promise. Just don't make fun of the stickers. They're my daughter's stickers from when this was her computer. This Thursday, and then we have another course in June, and then another one in September. We basically offer them every month because we want to equip as many people. Currently, 350 facilitators across Canada, and over 1,000 people have taken the course.
Any other questions? I'm sorry, it was kind of a bit of a downer presentation. I normally try to start with a joke. It wouldn't help. We have a member in Edmonton who's just a sweetheart. I always stay with her and her husband when I'm in Edmonton. She said her and her husband had done a Bible study on the book of Jeremiah, the prophet. She said, "Oh man," she said, "that was tough." She said, "I was never so happy to see the back end of a prophet as I was when we finished that Bible study in Jeremiah." She goes, "Jeremiah is as depressing as one of Larry's presentations."